Welcome. My name is Christoph Marcin. I'm a dermatologist in Stockholm, Sweden. I'd like to share with you some examples of how I assess and treat patients in my clinic to maximize the treatment outcome. This is Cassandra's first aesthetic treatment. She's looking for natural enhancement of the lips and cheeks. Cassandra is a young patient with good skin quality, firmness and elasticity. She also has excellent tissue coverage and shows only fine dry lines around the eyes and some mimic lines in her forehead. No static wrinkles so far. If we look closer at the lips, we can see that the proportion from the upper lip to the lower lip needs enhancement. It's very important to preserve the shape of her lips to fulfill the request for natural looking result. Now if we look at the cheeks, we can see a flattening of the cheek in a 3/4 view. So what we do by just adding a bit of volume in this area, we actually cosmetically enhancing the proportion of the cheek to the lower third of the face. For a young patient like Cassandra with firm tissue and good tissue coverage, I would use a filler from the Restylane Enhance family for enhancement of the cheeks. My favorite in this area is Restylane Lift. For enhancement of the lip, I would opt for Restylane Kiss from the Restylane OBT family. When working with injectables, especially when using a microcannula, it's important to really remove makeup, cleanse the face with an antiseptic lotion all over and not just at the entry point, as the cannula will wander around over the cheek. And also try not to draw it over the skin, always have some air in between. After piercing the skin, I insert the microcannula, lift the superficial fat pad, roll the cannula through this mass until I touch bone. From here I turn it towards a medial angle, medial direction, always paying careful attention to the location of the infraorbital foramen. Then I slowly insert the cannula into the deep medial cheek fat pad and inject a small amount of product with low pressure. As I inject the deep medial cheek fat pad, I can see the superficial fat pad slightly gliding upwards, both reducing the appearance of the tear trough and the nasolabial fold. It is important to inform the patient about the possibility of anesthesia all the way to the upper lip, which in our case is beneficial as we intend to treat the lips subsequently. So far I've injected 0.4 ml in a retrograde technique. I turn around the cannula, point it towards the zygoma, again lift the superficial fat pad and place a bolus onto the zygoma to create an apex for Cassandra's cheek. Keep in mind that for women the apex of the cheek should be a bit more laterally and a bit higher than in male patients. Now the last step in this injection is the augmentation of the malar fat pad by injecting supraperiosteal into the prezygomatic space. You know you're there when you no longer feel resistance. And again I inject with low pressure, small quantities as I watch the tissue augment. It's important not to place too much product close to the zygomatic ligament to avoid any bulging when the patient smiles and talks. In cases where you only intend to augment the lateral aspect of the cheek, you might as well use a different technique with a sharp needle directly onto the bone. Cassandra wants a natural looking result. I will show you how I inject the lip with the cannula technique, which is not always necessary, but is usually more comfortable for the patient. I prefer to have 4 entry points when I treat the upper and the lower lip, rather than having one entry point over the modulus, which reduces the need to break through this rather dense tissue and increases patient comfort. I simply pierce through the skin. I prefer 25G cannula because it is a bit firmer and easier to guide through the tissue, but if you prefer 27, that is just fine as well. When treating the lip with the cannula, it's important to use both hands. Use your non-dominant hand to straighten out the tissue to create a horizontal plane for the cannula to glide on. This reduces patient discomfort. Personally, I prefer to inject the mid of the lip rather than the vermilion border. It gives a more natural look to the lip. Once the cannula is in position, I inject with low extrusion force, small quantity of product as I retract. I watch the lip as the product slowly fills it, and that way I can easily control the amount of product needed to create a natural looking lip. So far I've used about 0.3 cc for the upper lip. Once a sufficient amount of product is injected in the lip, I prefer to invert the lip and mold and massage the product, making sure that there are no lumps, especially on the wet-dry border. Now let's go on with the lower lip. In the same manner as the upper lip, I inject the lower lip by creating a horizontal plane for the cannula to glide on, just until the midline of the lip. Once I've reached the final point, I press my thumb against the tip of the cannula and inject a small bolus stretching from the midline until a line through the ala of the nose and through the lower lip. This way you create a very natural looking, nicely everted lower lip. To fulfill Cassandra's request for natural enhancement of the cheeks, we inject a 2 ml of Restylane Lift into her cheeks, which is an amount usually needed for patients with firm skin, good tissue coverage, and pronounced facial features. As you can see, the amount does not over-project the chin, but rather gives a very natural looking OG curve and lid cheek junction, as well as transition from the upper to the lower cheek. For the lip, we used 1 ml of Restylane Kiss, and we split it 0.4 ml into the upper right lip, 0.4 ml into the upper left lip, and then 0.1 ml as a bolus on each side of the lower lip.